Good evening everyone. This is Dr. Ruchita Agarwal. I'm a gynecologist and I would like to discuss about preterm birth on this occasion of World Prematurity Day. Preterm birth is defined as birth of a baby before completion of 37 weeks. Early preterm is defined as birth of a baby before completion of 34 weeks, and late preterm is defined as birth after 34 weeks but before 37 weeks. Now, preterm birth is a significant health problem across the world because of associated neonatal mortality, short and long-term morbidity, and disability, since the developing organs are not mature enough to allow normal postnatal survival. According to WHO, more than 1 in 10 babies born globally are preterm. Around 1 million children die each year due to complications of prematurity. In India, out of 27 million babies born every year, 3.5 are premature. Now let's come to the etiology. It might be spontaneous, which includes low socioeconomic status of the mother, low weight of the mother, multiple pregnancies occurring at short intervals, genital colonization of infections, maternal medical illness, emotional, physical, psychological stress. Let's come to the induced factors, which might be diabetes mellitus, pregnancy-induced hypertension, antepartum hemorrhage, fetal hypoxia. Now, a preterm infant, the size is relatively small with a relatively large head, activity is poor, general posture is extended. Now, what problems a preterm neonate might face after birth? Those might be nosocomial infections, hypothermia, respiratory distress syndrome, low birth weight. Then in future, the infant may have learning disabilities, vision problems. Now let's come to the management. Primary management includes arrest of preterm labor by bed rest, sedation, tocolysis, and after birth, shifting the baby to NICU. Now, what is the role of progesterone? As the name suggests, progesterone is progestational. It is essential for pregnancy preparation, implantation, support and continuation. Acts as immunomodulator, increases nitric oxide production, which in turn increases uterine blood flow and endothelial adaptation. Dosage can be 200 to 400 sustained release formulations once or twice daily depending upon the situations, or even per vaginal capsules or depot injections weekly or twice weekly, which can be continued up to 34 weeks of pregnancy. So the side effects of synthetic progesterone can be minimized or even eliminated by the use of natural micronized progesterone. Now let's come to the prevention. How do we prevent preterm labor? Among primary prevention comes public education, policies like limiting number of embryo transfers in ART, maximizing paid pregnancy leave at work, omitting night shifts, minimizing workplace hazards, avoiding repeated uterine instrumentation, avoiding substance abuse, treating asymptomatic bacteriuria, providing proper antenatal periodontal care, which is very important, supplementation of zinc, omega-3, fatty acids in diet. Now, the secondary prevention entails identifying high-risk pregnancies by looking for a history of prior preterm labor, ruling out fetal anomalies, polyhydramnios, intrauterine fetal death, cervical insufficiency, and managing it with cervical cerclage. So to conclude, preterm birth is an unpredictable event. However, neonatal morbidity and mortality can be significantly reduced with judicious application of above-mentioned management guidelines, natural micronized progesterone being the cornerstone of all of it. Thank you so much.